Maria Parmesa Sabina Fernanda, but student number 102. Representing all members of HDB7 would like to say thanks for Dr. Jacqueline Sudiman as our facilitator and Dr. Ida Bagus Putra Pramana as our evaluator for helping us throughout the making of this paper. In this video, HDB7 would like to present our paper with the title of Urethritis in Urological Aspect to fulfill the assessment for blood urology system and male genitalia. These are the members of our group. There are two clinical conditions that may appear alongside urethritis or may also be the causative factor of urethritis, which are systemic lupus erythematosus or SLE and neoplasm or cystic. Urethritis in SLE patient is defined as the first symptoms as bladder and ureter injury caused by vasculitis diffusion in SLE may lead to neuritis and dysfunction of bladder and ureter smooth muscle, often appears as complication or recurrent state in SLE patient. Meanwhile, neoplasm is more often found present in urethritis case. Urethritis cystica is a rare benign condition of the ureter in which there are multiple small submucosal cysts and filling defects in the ureterium as a result of chronic inflammation in the mucosal lining of the ureter. There are two clinical conditions that may appear alongside urethritis or may also be the causative factor of urethritis, which are systemic lupus erythematosus or SLE and neoplasm or cystic. Urethritis in SLE patient is defined as the first symptoms as bladder and ureter injury caused by vasculitis diffusion in SLE may lead to neuritis and dysfunction of bladder and ureter smooth muscle, often appears as complication or recurrent state in SLE patient. Meanwhile, neoplasm is more often found present in urethritis case. Urethritis cystica is a rare benign condition of the ureter in which there are multiple small submucosal cysts and filling defects in the ureterium as a result of chronic inflammation in the mucosal lining of the ureter. Even though urethritis has good prognosis, the clinical manifestation of urethritis is not specific enough, causing it hard for clinicians to diagnose without uteroscopy and CT urogram. This paper hopefully may increase knowledge of urethritis and what is the treatment needed in order to manage urethritis, especially in urological aspect. These are the research questions and purposes of this paper. The benefit of this paper is to improve knowledge and deepen understanding about urethritis in urological aspect. More importantly, it can also be used by the next researchers as a supporting theory in order to increase knowledge and solve the problem related to urethritis in urological aspect.
My name is Atsa Sultan Pratama with student number 104. Next is the second capture about our literature review. Start from the definition of urethritis. In general, clinical urethritis condition is usually defined in line with the several causal factors, such as hematuria, fever, lower back pain, until the urinary irritation, because urethritis is often not to be found alone as the main disease or diagnosis. Therefore, urethritis has a high chance of clinical misdiagnosis. In addition, from the studies that urethritis is often incidentally found when examining other body organs, especially involving CT scan procedure. Some examples that can be given based on the clinical settings are: first, urethritis with the systemic lupus erythematosus or SLE. Urethritis with SLE can be defined as the ureter inflammation process in patients with SLE condition as the main causative factor. SLE that suffered by the patient in the study is resulted in occurrence of autoantibodies and systemic vasculitis involving uretropelvic area, for example ureter, as the intermediary channel of the urinary bladder until smooth muscle abnormalities intervention around it, by 0 until 5 years of hospital treatment. The second is polypoid urethritis or urethritis cystica, caused by neoplasm and referred as polypoid. It is commonly present as upper urinary tract infection, benign condition in proximal ureter. In fact, it has ability to mimic the clinical symptoms of upper tract urothelial carcinoma, with one of them caused by obstruction, resulting from the renal impairment. Therefore, it must be distinguished clinically from other conditions due to probability of malignancy and differences method in treatment process for the patient. Then there are other condition examples such as eosinophilic urethritis, occurrence of ureter inflammation with decreased level of IgG and elevated level of IgE. Afterwards, eosinophilic urethritis have an impact into urethral obstruction. Then also there is urethritis caused by Salmonella dublin bacteria, strongly suspected due to occurrence of previous pyelonephritis incident in patient beside of the bacteria. It is commonly found in the young cattle and often causing infection in lungs in more than 90% cases, in liver approximately 90% cases, and spleen in 62% cases. The urethritis condition is also directly defined by the suspected causative agent for disease based on ICD-10. For example, are urethritis kystica with N28.8 as the ICD-10 code, classified in other specified disorder of kidney and ureter. Then urethritis in the presence of calculus or stone with N20.2 ICD-10 code, classified in calculus of kidney with calculus or ureter. Urethritis caused by gonococcal infection with A54.2 ICD-10 code, classified in gonococcal pelviperitonitis and other gonococcal genitourinary infection, and urethritis condition caused by parasite schistosomiasis and tuberculosis with N29.1 ICD-10 code, classified in other disorder of kidney and ureter in infectious and parasitic disease classified elsewhere. However, there is not any single exact definition that mentioned by ICD-10 for the urethritis without any accompanying condition.
Good morning, Dr. and friends. My name is Aimelanawati Santoso, Nabal W07. I will present about the epidemiology of urethritis. So, urethritis is an inflammation of the ureter, and the cases is rare and associated with cystitis or pyelonephritis. Urethritis cystica is the most disease that frequently show in case report. Urethritis cystica occurs in middle-aged to elderly females following viral lithiasis and recurrence of urinary tract infection. In many countries in the world, urethritis cystica is the most disease related with urethritis. It has higher predominance in women and usually unilateral. Urethritis cystica is benign disease, and more case is suggested incidentally by urinalysis or radiographic imaging, and the cases in urethritis are varies among the patient. In some journals, mostly urethritis cystica common in women from 40 until 60 years with other symptoms such as flank pain, history of renal kidney stone, or lower urinary tract symptoms. After examination, urethritis cystica is found between examination. For disease related with urethritis, in some journals it was related with urinary tract infection and nephrolithiasis as to disease associated with urethritis. In Indonesia, it is difficult to find journal related with urethritis. Many of journal in Indonesia discuss about the urethritis, the inflammation of the urethra.
My name is Narsora, student number 135. So I would like to explain about the etiology and risk factor of urethritis. So urethritis itself can be caused by infections, and it can also be caused by hematogenous infection, autoimmune disease, and also infection that spread from another organ. For the example of urethritis, there's like urethritis cystica that can be caused by like nephrolithiasis or urinary tract infection. There's also urethritis caused by SLA, which is caused by an autoimmune disease. And the last one, there's a urethritis that caused by cytomegalovirus. It's also caused by bacteria. And the higher risk factor, there is a patient with a ureteric stent, especially when it is like a long-term use ureteric stent. Thank you.
Hello, doctors and friends. My name is Anish Sharma with team last digits 251, and I'll be elaborating about the pathophysiology of urethritis. Urethral cystica manifests as cystic areas of glandular metaplasia, which is associated with chronic urothelial inflammation. The bladder is the presentation where it is commonly seen, also the site where it is called cystitis cystica. Cystitis cystica occurs when urothelium is located in the center of von Brass nests. The von Brass nests are located in the lamina propria within islands of the benign apparent urothelium. Inside in cystitis cystica, the nodules are located in trigone and the neck region in the bladder. In microscopic examination of the ureteral biopsy of patient, there is an intact cystic structure which is shown which is lined by benign urothelium with umbrella cells which are intact. It is usually more consistent in cases of cystitis cystica. Hence, during differential diagnosis, ureteral cystica should be considered when there are defects or small fillings with bead-like appearance located along urothelium of renal, pelvis, ureter, and bladder. That is all for me. Thank you for listening.
My name is Jakarta Isabati Pemayon, with student number 252. Urethritis are mostly asymptomatic, but if symptom does occur, it varies according to the patient condition and its etiology. Urethritis may be diagnosed incidentally on a CT or an MR scan during urinary tract imaging for other conditions. There are several types of urethritis such as urethritis cystica, eosinophilic urethritis, urethritis related to cytomegalovirus and or Beca virus. Urethritis cystica is a rare benign condition of the ureter characterized by the presence of numerous small cystic lesions less than 5 mm in diameter. This condition mainly affects middle-aged to elderly female patients. Eosinophilic urethritis is a rare and poorly understood type of urethritis. Etiology is unknown. Patients with eosinophilic urethritis commonly present with flank pain and ureteral obstruction. Patients with late-onset cytomegalovirus infection can show atypical features like hemorrhagic cystitis, cytomegalovirus retinitis, and ureteritis. Beca virus is the most common pathogen causing viral nephropathy in renal transplantation recipients. Ureteritis may occur due to secondary infection of Beca virus. Ureteritis may lead to ureteral stenosis and commonly affect the distal part of the ureter. This condition often occurs around the site of anastomosis at the ureterovesical junction. Okay, thank you. Next.
My name is Sarah with registration number 073. Now I'm going to talk about the diagnosis of urethritis cystica itself. So the diagnosis is usually suspected when there are defects of fillings seen in the ureter under contrasted images in the urinary tract. Although usually we can see it in an incidental finding, but it can also be present with the acute flank pain. So the most commonly used imaging are excretory urography and retrograde pyelography, in which we can observe numerous filling defects which are well defined, rounded smooth contours, often with a scalloping appearance. And usually CT scan or MRU can be used to better define the nature of the lesions or extent or even the presence of other abnormalities. Differential diagnosis are other lesions that can have similar appearance, including like radius and stones, clots, veins, air bubbles, or tuberculous ureteritis. And when imaging studies are not conclusive, we can do ureteroscopy. And when we see it under a microscope, histopathologically, the biopsy will show an intact cystic structure lined with benign urothelium with intact umbrella cells, in which we cannot see any goblet cells or dysplasia or signs of malignancy.
Good morning, doctor. My name is Kiki Gavira with last three digit number 160. So the differential diagnosis can include multiple transitional cell tumors, ureteral pseudodiverticula, non-opaque calculi, polyps, papillary tumors, vascular impressions, tuberculosis, iatrogenic gas bubbles, gas forming microorganisms, and submucosal hemorrhage. All of the above can be considered with an appropriate clinical correlation.
Thank you for the opportunity. My name is Eduardo Quinjero with last three digits of my serial number is 119. As described in previous sections, urethritis is a very rare and poorly understood entity. Management of urethritis aims to relieve symptoms and elevation of proximal urethral obstruction to optimally preserve renal function. Regarding the treatment of urethritis, once it is known or it is found, complete excision can be performed for symptom relief. Ureteroscopic resection with laser ablation or loop electrocautery is considered safe and usually acceptable to the patient. Alternative techniques are silver nitrate instillation, balloon dilation, or long-term antibiotic therapy. In asymptomatic patients without evidence of obstruction, the intervention is not required at all. In the context of urethritis as a result of other diseases, the first step that needs to be done is to treat the underlying disease first, then treat the symptoms that appear in the patient, and finally treat the urethritis. Apart from being supportive, management of urethritis also involves long-term surveillance to anticipate malignant changes. That's it from me. The next one is going to be explained by my colleague. Thank you.
Thank you for the time. My name is Joshua Imanthro with the last 3-digit NIMS number 035. With proper diagnosis and treatment, urethritis are known to have a good prognosis. Through a study by Janero et al., urethritis can be diagnosed through endoscopic examination. Aside from that, Rothschild and Wu also found out that urethritis are often found through incidental diagnosis and by being included in a differential diagnosis. Other than that, there are several treatments that are currently used for urethritis. Poturalski et al. Stated that several management include urethral dilation, catheterization, and other conservative treatment. Through both proper diagnosis and treatment, urethritis are known to have a good prognosis. There are several etiologies for urethritis. Urethritis TB are known to be unsuspicious but are easily identified. Therefore, its prognosis depends on its timing of diagnosis. Secondly, urethritis cystica or urethritis caused by neoplastic conditions are known to be curable without any active treatments, and therefore with effective management, it is believed that urethritis cystica are known to have good prognosis. Thank you.
My name is Matthew, last digit 114. Today I want to explain about complication in urethritis. In men, it may lead to cystitis, pyelonephritis, epididymitis, orchitis, and prostasis. And in women, it may lead to PID, cervicitis, salpingitis, or infection of the ovaries, fertility problems, ectopic pregnancy, miscarriage, and other complication of pregnancy. Thank you.
My name is Komangjini Putri, number 031. Conclusion. Urethritis defined as inflammatory process that occurs in the body of ureter and associated with cystitis or pyelonephritis. Urethritis cystica is the most common disease related in the urethritis. Ureteral cystica manifests as cystis area of glandular metaplasia, which is associated with chronic urothelial inflammation. Urethritis is usually asymptomatic. The symptoms vary based on the patient condition and medical history. Confirmation of urethritis cystica can be done with radiographic imaging such as retrography, computed tomography, or magnetic resonance imaging. The treatment of urethritis can be performed by complete excision for symptom relief. In asymptomatic patients without evidence of obstruction, intervention is not required at all. Urethritis can be directly correlated with a better prognosis through early diagnosis. Okay, that's all from the SCDB 7. Thank you for your attention. Thank you very much.